Philippines is no stranger to dengue. Last year, there were 142,000 plus recorded dengue cases in the country, contributing to the 400 million cases worldwide. Dengue is indeed a threat to many Filipino families, but the long battle with dengue can now finally be over through a vaccine called DENGVAXIA. But is it really the answer? Joining us now here in the studio is Dr. Anthony Liachon. He's the president of the Philippine College of Physicians Foundation. And on the phone is DOH, or the Health Department spokesperson, Dr. Lyndon Lee Suy. So let's begin first with Dr. Liachon. So let's begin with this. You are against the rollout of the vaccine, the dengue vaccination program in the Philippines. Why?
I'm not against the launch of the dengue, so perhaps people should have that kind of understanding. We welcome the opportunity to launch a vaccine because it's a treatment option aside from vector control. So I think the major concern...
Vector control meaning?
Vector control meaning you control the cause, which is actually mosquito.
Right, okay, so prevention.
It's the prevention aspect.
Okay, so you're not against it, but
no.
What are you against? The timing?
The timing of the launch, and of course the infrastructure related to the safety concerns.
Okay, so let's define. When you say timing and infrastructure related, what do you mean? Timing. So not this month, not April 2016. So what do you want?
Basically, my main concern is that we would like to wait first for the World Health Organization guidelines, which is basically the strategic advisory group of experts guidelines, because they're the global agency, more or less experienced and knowledgeable about vaccination.
You don't have enough trust and confidence in the experience of the doctors here in the Philippines?
It's not that, because we're the first country to launch it, though there are other countries with already marketing approvals.
Yeah.
But the other countries in Asia with, I would say, better health systems like Singapore and Malaysia are not launching it as well. So my main concern is that if it is only about 2 months or 1 month from now, why not wait for the SAGE guidelines so that will be directed properly?
Yeah, those recommendations are supposed to come out in May. You're saying that let's wait until after May.
Right.
But you're also saying that you don't have enough trust and confidence in the Philippine healthcare system for it to be able to, well, absorb any, if anything goes wrong or what?
No, I have confidence in the Department of Health. But my main problem is about seeing right now safety nets regarding adverse reaction.
Okay, safety nets meaning, and adverse reactions meaning what? Like side effects?
Like for transparency, I was in the pharmaceutical medicine for 20 years, and I know the phases of drug
When you're saying pharmaceutical medicine, you were with a pharmaceutical firm before.
Right.
So which one was that?
It was Pfizer.
Pfizer.
Okay, so I was...
You were medical director?
Yes, I worked there for 20 years. Launched one of the biggest products in history.
Which one was that?
Viagra, Lipitor, Celebrex. Okay. So, as a physician right now, my main concern is basically the safety aspect. When you launch a drug in the market, it's a mandate that you have a post-marketing surveillance study, meaning to say you have a clinical protocol, you have a risk management plan, you launch it first in a pilot study with the doctors and see the side effects and then report this to the FDA. Now, since this is the first drug...
And none of this happened here?
I'm not sure, but there's a...
Weren't there enough studies, there are 15 to 20 years of studies, not just here but abroad. We're going to be speaking to the RITM, Dr. Capeding, in a while, and she's going to be saying practically the same thing.
The studies done by Dr. Capeding and the other studies globally are actually in phase 3, which is actually the studies you need before launching into the market. What I'm saying is the phase 4.
Post-marketing.
Because these are actually limited number of patients. They say 5,000 or 10,000, 30,000.
So, Dr. Liachon, if you're saying why the rush and you question the timing, you're saying that the health department, the Aquino administration, the Philippine government rushed into launching this April 2016 because of what?
I don't know.
You don't know?
My main concern is the infrastructure related to the safety. Because once you have this, because the main problem is that usually we launch it among doctors, and doctors will monitor the side effects. My main
When you say
concern,
launch it among doctors, you mean what?
you launch it among doctors, and there's a clinical protocol. The doctors will follow up the patients. Let's say,
Okay.
let's
So
say,
if they have, if you halimbawa, you have a patient na may dengue,
Right.
or well, this is vaccination, so you'll try it on this patient, then let's see what happens to this patient.
yes, but it's
Okay.
already the real world. Right. So, for example, you're my patient, and then after one month, you'll follow up and see if there's a reaction.
Okay, okay.
And then you collate all this data, and you have to submit this to the FDA as a requirement.
Okay, so what are the possible side effects? Can you...
Variable, depending on the package insert. Kasi may package insert yan eh. Meaning to say, kung ano yung nakita mo dun sa studies in the small scale. For example, you can have fever, you can have rash, and you have to explain that that is a potential side effect as well. So there must be a consent form, right? So ibig sabihin, if you ask for a consent form from the student, from the mother,
Yeah, you're scaring people that way.
No,
I'm
no,
not saying
no,
that.
no, no, so- sorry,
Well, I mean, if you
sorry.
say death is a...
it's-
of course, you're going to scare people off.
right?
Yeah.
Because one mistake lang dito, that will ruin the whole vaccination program. Hindi lang dito, but across the globe.
Well, I want to ask, and it's interesting. Earlier, you said right away, in the interest of disclosure, I was with Pfizer. You are a cardiologist.
Yes,
correct?
yes.
Have you ever handled dengue cases? You
Kasi-
have also.
Kasi internal medicine din ako eh.
Okay.
So, in practice naman, majority ng cases are internal medicine cases, mga 60%. So, ibig sabihin you handle this case then. Kasi
Yeah,
you're
okay.
internist.
And, well, let's talk first to Dr. Lyndon Lisuy, the spokesperson of the Health Department. Can we go straight to his concern about why the rush, and, he's questioning timing, for example, and this whole, is the infrastructure there for this entire rollout of the dengue vaccine?
The launching was planned as early as December, and ang plano talaga was to provide the first dose before the rainy season, simply because based on the study, the first dose will already provide partial protection to
Well,
the
that's why it had to
recipient
be
of the
April.
vaccine.
Ang habol nyo,
Yes.
June. Okay.
Bago, para pa kung magtag-ulan,
Yes.
the target population would already have some partial protection already against dengue. Number two, I guess the rush was correlated as well with the SAGE, or the strategic expert on, advisory group of experts from WHO. It is not a requirement actually for the country to wait for the SAGE recommendation before the country gets to use a vaccine, although that would help. Definitely that would help. Because the SAGE will come out with recommendations on how to best use the vaccine, actually. But then what's important with the vaccine is that it is registered with the Philippine Food and Drug Administration, which would have the same requirements as with the SAGE requirements before they get to come out with their recommendations. Now, the other concern was on infra regarding the monitoring of the adverse event following immunization or side effect and the referral system. Since December, we've been doing a lot of orientations and planning together with the local government units in the schools on how to implement the dengue school-based immunization. In fact, the RHUs will be the ones monitoring as well, and will be the referral site of any students that would show any form of manifestations or any form of side effects, kaya sabihin natin mild fever, ito o low-grade fever. It has to be recorded because that will be part of the post-marketing surveillance as well. Lahat ng klase ng reaksyon na pwedeng magkaroon ng isang pasyente na nabigyan ng bakuna would have to be documented.
When you were talking about April, para hinahabol nyo kasi the start of the rainy season and when kids go back to school, hindi pa ba sapat yung mga sinasabing vector control measures, fumigation, environmental cleanliness?
Well, tiyak kung naging sapat yun for the longest time. Sana na nagkaroon din na addressing concern ng dengue dito sa atin. And I'm pretty sure na monitor mo naman yan over the past few years. Pagdating sa vector control kasi it's a shared responsibility, di ba? between the family, the community, the local government unit, and the national office.
Yeah.
Kahit na mag-ingay tayo, if the family doesn't get to share their responsibility, may hirapan tayo.
If you say that you had to launch in April, again, I'm repeating myself, launch in April dahil habol yung rainy season, etc. But then you have these recommendations of WHO that are coming out by May. Would it have mattered if you had waited just a while, just to, I guess, ease the doubts of some people, or doubts created by people who don't believe in what you're doing?
Yeah, but then, sabi nga natin, we also sought the expertise of our colleagues from the infectious disease world and also from the vaccine group as well. And they all came up with a consensus that we can proceed with the vaccination provided that we have a very good monitoring system.
Does the vaccine really protect us from dengue?
Yes.
Yes. Because Dr. Liachon here is saying no. Okay, so you're saying yes, believing in that fully.
Yeah, we wouldn't have done this kung talagang may doubt at may concern dito.
Is this, Dr. Lisoy, is this an experimental vaccine? Are we experimenting with these 31,000 school children in Region 3, Region 4? Are we experimenting,
No.
or this is not an experiment?
Alam din natin yan sa registration process, and I'm pretty sure Dr. Liachon knows this as well, na pag na-register na to, we're past this experimental phase.
Yun na nga, parang nasa post-marketing phase pa lang daw. So, paano yun?
Kaya ganito yan, Pia. Ang isang bakuna, kahit nasabihin mong nasa market na siya for some time, 5 years, 10 years, pag merong reaction na nangyari sa isang pasyente na nakatanggap ng bakuna, it will still have to be reported.
All right, we'll just have to take a short break. So, Dr. Lyndon Lisoy, please stand by, still on the telephone. I'm so sorry about this. And Dr. Liachon, still here with us in the studio. News.ph will be right back. Stay with us. Welcome back to News.ph. Still with us, Dr. Tony Liachon, and on the phone, the Health Department spokesperson, Dr. Lyndon Lisoy. We're talking about the dengue vaccine program that was just rolled out by the Health Department. Dr. Lisoy, during the break, Dr. Liachon was explaining that the rollout kasi is just the first dose, so it doesn't really immunize the children.
Yeah. Lyndon, ang concern lang, kung imumove mo siya, makuha mo yung WHO guidelines, it will be important kasi it's the first time in the world we don't have any experience And alam mo naman din doon na on the first dose, hindi pa naman completely immunized ang patient. So therefore, moving it and then having the WHO guidelines will be important. And then number 2, kung talagang siya extremely safe for us, why would we need consent form and intensified post-marketing surveillance? And there are ongoing trials of the pharmaceutical company kung talaga siyang deemed as safe. Kasi pag nagpapabakuna ka naman sa mga ordinary natin, measles, diphtheria, and all, you don't have consent for them.
Okay. Dr. Lisoy, can you respond to those 2 points?
Lahat ng ginagawa namin karamihan sa mga school-based immunization activity namin, nire-require namin ng consent form. Yung sa deworming, yung bakuna for grades 1 and grade 6, lahat yan nire-require namin ng consent form. One. Yung sinasabi ni Sir would be the RH na nasa record na nila na may mga subsequent doses, yung iba hindi na nire-require nila ng consent yung nangyayari sa RHU. But then for the school-based immunization activities namin, and this is not the first time we're doing this, we already have other vaccines that have been instituted to the school as well na nire-require talaga yung consent form. So this is not the first time we're doing this. Nabanggit din yung Sir din kanina regarding the importance of the post-marketing surveillance. This is basically the reason why we're doing monitoring. Dahil sabi nga, first time to be introduced in the world, we wanted really to document. Totoo naman yun, na kung ano ba yung mga posibleng mangyari. We wanted to have a very good documentation na kaya ang talaga natin, we're very strict with the monitoring system. Kaya like what Pia you said, well, di ba nakikita naman talaga yung isang may lagnat, even though we still need to really monitor this and report this.
Dr. Lisoy, is the vaccine safe?
Yes.
Yes, it is. So we have nothing to worry about. As a parent, I would not have to worry if I had my kids vaccinated with that.
In fact, isi-clear ko lang din, Pia, ha, bago namin in-introduce nito sa public health side, ginagamit na ito. Mas nauna nag-introduce ang private sector. Yung mga private physicians has been using this vaccine already for about a month or two bago namin in-introduce ito ng DOH.
A month or two. Have they been reporting? Have they been reporting back to the health department about how things have been going after that?
Yes. Meron din kami coordination with the private.
What have they said?
Favorite din. Ganito lang din yung nakikita nilang reaction ng mga students.
Okay. Dr. Lee Sui, on social media, some people are saying we are the laughing stock of international health experts, because we rolled out this program in several regions. Why the rush? Let's wait. Let's wait till it gets cheaper. Let's wait till WHO says something definitive about it, etc.
Well, siyempre nakakababa din ng sa amin yan with the good intention sana to provide protection sa mga bata against dengue. But then yung laughing stock, I just do not know where it's coming from. In fact, we've been receiving a lot of congratulatory note coming from different experts globally as well, and one could be from the ASEAN Dengue Vaccine Association. We just received congratulations to the Philippines for initiating this one as well. In fact, one of the advocates came into the Philippines this week to really see on what was going on, because they wanted really the other countries to use this as well.
Okay, Dr. Liachon, you have something to add?
Yeah, Lyndon, I'd like to put on record na kinongratulate ko ang Department of Health, Special Secretary Garin, for this initiative. And it's a landmark or historic milestone. Truly, ang concern ko lang, and some of the other academicians and health experts, is the timing lang, waiting sana for the World Health Organization to complete it.
Although,
that's one. And then number two, yung infrastructure na hindi nakascade to all, not even, let's say, the Philippine College of Physicians, very limited.
It's interesting, yesterday, World Health Organization country representative was quoted as saying, and we quote, "It is not the WHO's mandate to license a medical product to determine whether or not a product should be used in a country. This is the prerogative of the national regulatory authority of a country." And he says that, yes, although the recommendations are going to be out in May, it doesn't mean that it should stop any country from instituting any program.
Yeah, that's true, because the World Health Organization is an organization or agency na nagbibigay direction or gabay, but it's still the prerogative of the Department of Health whether they would like to launch it ahead of the WHO guidelines.
So before we, I want to say thank you first to Dr. Lee Sui. Dr. Lee Sui, any other final words before we go to Dr. Rose Kapeding?
I just hope they see the wisdom on why we're doing this one, and that we wanted to provide protection. And definitely, rest assured that we're looking into all the possible aspects na sana hindi magkaroon ng problema.
Okay, all right. Thank you very much, Dr. Lyndon Lee Sui, spokesperson of the Department of Health. Let's speak now via telephone to Dr. Rose Kapeding. She is the main investigator of the dengue vaccine from the Research Institute for Tropical Medicine, or RITM. She did all the studies of the dengue vaccine in the Philippines and is a board member of the Pediatric Infectious Disease Society of the Philippines. Ma'am, you agreed to talk to us about the clinical trials here in the Philippines. Can you tell us more about that? Because there's a lot of doubt that has been created with what those opposed to this vaccine program are saying. So can you tell us more about the clinical trials here in the Philippines of this vaccination?
Okay, so we conducted this clinical trial. We call it the dengue vaccine efficacy trial. So that's the name is CYD14, and this is participated by 5 countries in Asia. So Philippines, Vietnam, Indonesia, Malaysia, and Thailand. So we conducted the phase 1. So there are 4 phases of clinical development of a vaccine or a drug. So we started with phase 1, and then with phase 2, and then this time the phase 3, that's the efficacy trial.
All right. And because of these clinical trials, you feel that the health department can give that go signal to roll out the vaccination program?
No, our role is to to conduct a clinical trial, and then we have a result to show that it's a safe and effective vaccine.
It is a safe and effective vaccine. There is no reason to doubt it. There is no reason to fear it.
Yes, our role was to conduct regarding to look at the safety and efficacy of the vaccine.
Okay. So, ma'am, earlier, this was a question I had asked of Dr. Lisuy. Itong pag-roll out po ng vaccination program, this is not like an experiment, right? We are not experimenting because we had gone through clinical trials, and you, like you say, because of those clinical trials, we're able to say that the vaccine is safe and effective.
Yes.
Is there anything else you can share with us, ma'am?
So far, what I can say as principal investigator of this clinical trial, that it's a safe and effective vaccine. And I just would like to say for those people, for example, or individuals who still don't believe about the vaccine, I think everybody can wait for the next dengue vaccine, but at the moment I can say that I really don't know when it will be available.
All right.
Yeah.
Well, Dr. Leachon, you wanted to say something before we say goodbye to Dr. Kabiti?
Because we're experienced investigators kami ni Rose, and always we look up to international guidelines and a blueprint na post-marketing kasi this is the first time na gagawin and we don't want the Philippines to fail. Perhaps yung isang question lang ni Dr. Dance na gusto kasi hindi siya nakarating din or what, is basically the antibody dependent enhancement that in the long run you may actually reduce the milder cases, but in after 3 years you can see the severe cases of dengue.
Okay.
So
yeah, before it gets more complicated than that, Dr. Ora, can you respond to that?
There's always that sinasabi natin, theoretical risk of ADE and second infection. So, yung dito sa atin, for those hospitalized cases, for example, ang nakita natin sa ADE, walang nakita doon na in terms of the presence of high ng virus in the blood for those hospitalized ones, and then yung severity ng clinical manifestations, and also yung tinatawag na, pero kasi sa medical, it's about yung tinatawag na increase in the cytokine profile, which was not present in those vaccinated group. So, I think in the next few years that we will have the next dengue vaccine. So, and I can assure you, this one is a very safe and effective vaccine.
Okay.
Well, that's very reassuring. Thank you very much, Dr. Rose Kapeding of the RITM. Maraming salamat po, Doktora. All right.
Regards, Rose.
Dr. Leachon, final words from you, very brief.
My major concern lang is basically waiting for the WHO guidelines. And of course, the pre-qualification, yung sinasabi, if you study this in the long run, it will be affordable. Kung everything is in place right now, yung safety nets, yung post-marketing surveillance study, then makakatulog lahat tayo. And we hope na mahimbing.
And the Philippines would have led the way.
Yes.
First Asian country.
Right. So, good luck to all of us, and we will try to help you and add value to what you're doing right now.
Thank you very much to all our guests, Dr. Tony Leachon, maraming salamat, Dr. Rose Kapeding, and Dr. Lyndon Lisuy, who spoke to us earlier via telephone. And thank you for watching News.ph. See you again next Wednesday. I'm Pia Ontiveros.